I'd like to invite the next speaker, Dr. Shaoying Tan from Hong Kong, to give the next talk. You have the pre-recorded talk? Yeah, okay, so she's unable to come, so we'll have the pre-recorded talk. Thanks.
Hello, I'm Shaoying from Hong Kong PolyU. I would like to extend my gratitude to the organizing committee for including me. Unfortunately, I'm unable to attend this meeting in person. I want to take this opportunity to send my greetings to all of you and wish the conference a great success. And here I will present the topic on cellular and molecular approaches to treatment of neuromyelitis optica spectrum disorders. The projects are supported by several research grants, and there's no financial interest in this presentation. Neuromyelitis optica spectrum disorders, NMOSD, is a severe central nerve system autoimmune inflammatory disease that can cause the demyelination lesions and neural injury. Myelitis and Opti neuritis are two of the main manifestations. The current treatment options are limited. Poor visual outcomes and a high number of recurrent attacks are found in NMOSD patients, even after long-term therapy. The prevalence of NMOSD is from 0.5 to 10 cases per 100,000 people, but it is more common in Asia population. In terms of the mechanism, it is widely accepted that ACOP4 IgG, which is a specific antibody produced by the serum B cells and plasma cells, penetrates into the central nerve system, resulting in binding in the ACOP4 channels on astrocytes, and then lead to the complement-dependent cytotoxicity, eventually damage to the astrocytes, oligodendrocytes, leading to demyelination and neural loss. The current clinical management, including the treatment in the acute phase to alleviate the symptoms and the remission phase to prevent the relapse. The patients are usually treated with high-dose steroid and immunosuppressive therapy targeting the production of the antibodies. However, the efficacy is limited. More than half of the patients remains poor vision or suffering recurrence. The long-term systemic therapy causes several side effects and complications, also influence patients' quality of life. So it is necessary to develop new and effective approaches to treat NMOSD. This diagram shows again the mechanism on the ACOP4 antibody produced and passed through the ABB and then combined with the ACOP4 on the astrocytes, so that the targets of the medications are going along with the pathway. For example, the current therapeutic drugs are mainly targeting to the B cells and plasma cells. The development of more new agents is ongoing. Some of them have entered the phase 2 and 3 clinical trials. Our team has conducted serious clinical studies on the efficacy of those treatment options and new medications, such as the rituximab. And in this presentation, I will focus on the work of cellular and molecular approaches and introduce the one we have attempted blocking the binding of ACOP4 antibody to the ACOP4 channels. Well, the protein structure of the ACOP4 consists of 3 extracellular loops, loop A, C, and E. Therefore, the combination between the antibody and the ACOP4 protein must be on these 3 loops. The peptide sequencing of the 3 loops are known. We have the idea that design and synthesize the 3 loops in vitro and use this recombinant peptides to neutralize the ACOP4 antibody in serum. Based on this idea, we conducted several experiments. First, it has been proven that ACOP4 IgG concentration detected by ELISA in the samples of the patient's serum. can be significantly reduced by the pre-mixture with the mammotab peptides, especially with the loop A and loop C, and the mixture of the loop C, ACE. This data demonstrates that ApoB4 IgG in patient serum can be recognized and neutralized by the mammotab peptides. We performed the cytotoxicity IC and live cell immunofluorescence experiments in a primary astrocytes culture, which also suggests that the mammotab peptides could reduce the cytotoxicity of the ApoB4 IgG to the astrocytes. We further tested whether the mammotab peptide could block the binding on spinal cord tissue from Lewis rats. The results consistently show that the loop A and C significantly reduce the human IgG labeled area at the spinal cord. Our data implied that the mammotab peptides were able to reduce the cytotoxicity of patient serum to the mainline of the spinal cord. We then tested and confirmed the protective effects of the mammotab peptides in our in vivo rat model by the functional and the structural assessments. We can see the graph showing that the loop C significantly reduced the binding of ApoB4 IgG to the spinal cord tissue and inhibit motor function impairments. However, the current understanding of NMOSD pathogenesis comes largely from research conducted in the brain and spinal cord, but not the optic nerves. Questions have been raised about whether the pathogenic mechanism in the brain and spinal cord also applies to the NMOSD-ON. Spinal nerves and optic nerves are essentially different. The spinal cord contains both motor and sensory nerves, but optic nerves are only sensory nerves. The particularly high sensitivity of the optic nerves to the ApoB4 IgG in NMOSD-ON is still unexplained, and it is not yet known whether the pathogenic epitope of ApoB4 are also localized at the extracellular loop C on the astrocytes around the optic nerves. The effects of synthesized ApoB4 mannitop peptides in reduction of the neurocytotoxicity in NMOSD-ON are also need to be demonstrated. So that we continue our studies specifically to the optic nerves, so-called NMOSD-ON. Firstly, we tested whether the mammotab peptide could block the binding of ApoB4 IgG to extraviral optic nerve from the rat. The results shows that all the mammotab significantly reduced the human IgG labeled area. We also tested in the mouse optic nerve. Results showed that the loop C and E significantly reduced the human IgG labeled area, implied that the ApoB4 mammotab peptides were able to reduce the cytotoxicity of the ApoB4 IgG to the optic nerve, which is slightly different from the result from the rats. Further studies are needed to address the reasons. So far, we have tested the effect of synthesized ApoB4 mammotab peptides in reducing ApoB4 IgG cytotoxicity to ex vivo optic nerves. We have successfully established an NMOSD-ON mouse model by intracranial injection of the ApoB4 IgG on the optic nerves. I have another presentation to introduce this model, and for those who are maybe interested, please refer our published paper. So the next step for us is to validate the effect of synthesized ApoB4 mammotab peptides in our in vivo mouse model. Hope I can share with you the results next time. So I would like to summarize some points at the end of my presentation. NMOSD is a severe autoimmune inflammatory disease, and the current treatment options remains limited. Ongoing research is focused on developing new agents. We have developed a novel approach to inhibit the binding of ApoB4 antibody to ApoB4 by synthesizing ApoB4 mammatope peptides. Our preliminary results contribute to understanding the pathogenesis of MSD, and this targeted therapeutic strategy aims to enhance treatment efficacy and improve patients' outcomes. Finally, I would like to thank all my teammates and colleagues in Hong Kong PolyU and my collaborators from the CHK and mainland China. Thank you very much, and I hope you all have a fruitful time in New Delhi.